Hi, I'm Dr. C. I am a doctor that provides transgender healthcare. I am a sole private practice and started this practice because I couldn't get care and my patients couldn't get care. I provide hormone therapy. I start folks on hormones. I continue them. I work outside the box to get people the care that they need. I do gender affirming care for minors as well as puberty blockers. I do post-op care for folks who had surgeries far away and need checkups. I also do surgical referrals and other forms of gender affirming care. We also do provide gender affirming electrolysis, which is permanent hair removal, and that is for facial hair, body hair, and for gender reassignment surgery preparation. I'm one of the only providers outside of the major cities in this state that provide gender affirming care to minors. I have a catchment area of over 5 counties with folks traveling 2 to 3 hours to come see me. Once they've established, I have telehealth ability to take care of them virtually. And that's with someone that they've met, that they know and they trust. It's also been really wonderful to provide gender affirming care as a non-binary trans mask provider. Most of my patients have never seen a transgender doctor, and that's huge. I often have people cry in my office, not because of shame, misgendering, or bad experiences, but because they've never had a medical experience like this, and they've never been so seen or so affirmed. The way that we are looking at moving forward is moving to nonprofit status. That way we have less tax burden, because in most cases physicians make a lot of money, and every physician practice that you look at is going to have a restriction on Medicaid patients so that they can keep their doors open. And that's not how I want to run my business. And moving to nonprofit status will allow us to have less of a tax burden, as well as have more sustainable options for regular giving, fundraising, and grant access. Hiring a grant writer is going to also be part of that, because I'm a doctor, not a grant writer. We were able to stay alive and stay open during COVID, seeing patients in person by providing masking and increasing our use of telehealth. We were able to do that by taking out loans, and that's part of the debt that we want to catch up on. We have an accessible space. Accessibility is very important to me. We have wheelchair accessible exam rooms and bathrooms. We allow for telehealth for established patients so that people don't have to leave their homes in order to get the care that they need. Providing that care has had costs. We've had to increase supplies, get the telehealth contracts up and running, making sure that insurances are paying for the telehealth contracts. We don't want to be another COVID story of a business failing, particularly because we're providing care that's not available elsewhere. We are still seeing patients on a weekly basis, that we're open 1 day a week as a specialty clinic. I have made a commitment to not restrict any Medicaid patients, because so many of my patients are in that category, that they don't have access to other forms of health insurance, and they need to get the care that's life-saving. With that, it's been a struggle, and debt has increased, and I'm trying to keep my practice open. Ideally, I'd love to be able to get 2 months of operating expenses so that we can get through to the nonprofit status, get the grant writers hired, and move forward. We are having to pay the next round of malpractice insurance, which is about $1,200. If you could cover the amount of a copay, that would be amazing. That could range anywhere between $20 to $100. That would help us reach our goal. I have one electrolysis employee, and She has an emotional support dog that is here every day. And she is a white little fluffy one that welcomes everyone who comes in. Then we also have, on rotation, some cats that come through, some kittens that have grown up here. We also do have a ball python who is part of the welcome crew in the waiting room. We've even had these animals been involved in the care of patients. I have a pediatric patient who was terrified of needles, wanted to hold the snake while getting her first puberty blocker. And it distracted her enough to be able to get that injection without having much pain. This is my passion. This is the project that I don't want to see go away. I don't want to have my patients have to try to find someplace else. I want to keep going. If you can help me with that, that would be amazing. You are helping hundreds, if not thousands, of trans patients, kids, teens, adults, and the elderly, our trans elders, get the care that they need. I want to thank you all for watching. I want to thank you all for donating, and I want to thank you all for caring about the transgender people in your community and in your lives and for yourself. That many of us grew up in places where it wasn't safe to have those thoughts, much less be who you actually are. And getting the care that you deserve and need is life-saving. So by donating, you are helping save lives.